Hi, princes and princesses, and welcome to another episode of Melanie Sliced Thinner. I'm Melanie, and you're going to notice that I have on my big crown today. This is my Miss America replica crown, and I'm wearing it for a reason. That's because as of today, I have, since the day of surgery, officially lost 100 pounds since surgery for a total of, let's see, three. I wish three. I've lost a total of 116 pounds since the very beginning of the process. But that means 100 pounds lost just from the surgery as of today. Y'all, I've been in the 220s. It seems like forever. I did not think I was going to break out of it. I was starting to be like, what the hell is going on? But finally, the scale was in, the odds were ever in my favor today. So we're down to 219. Yeehaw. And that means 199. I'm coming for you. I am coming for you, 199. It may not be anytime soon, but I'm going to get there and I'm going to kick your ass and I'm going to say goodbye to the 200s forever. Yeah, so oh gosh, it's been crazy. I'm not doing anything different. I've just kind of stepped up my exercise a little bit, but that's been about it. Nothing eating wise. I'm still doing high protein, high fat, low carb, just like I've been doing all along. And for those of you following along at home, you're going to go, high protein, high fat, low carb. That sounds a lot like keto. Sure does, doesn't it? For those of you, it seems like a lot of people lately have just been going crazy on keto. Everybody's been keto. Fantastic. Congratulations. Welcome to how a true DSer eats all the time. Now, I know some traditional DS veterans who are veterans, I'm talking 10 years out, who eat more carbs. Some of them will go as high as 60 grams of carbs a day. Did you hear that? Only 60 grams of carbs a day, and these are veterans. But true DSers who are compliant and who are eating how they need to be eating and following the DS rules, the lifelong DS rules. They're keeping the carbs low, protein high, and fat very high. So yeah, all you keto people, welcome to my life as it has been from the beginning. Oh goodness. Let's see. Otherwise, everything has been going pretty good. Some people have been asking me about my labs. When is my next follow-up going to be? I see my surgeon's office again at my 1 year, and my 1 year is going to be, I had surgery on March 30th, 2016, and my next appointment is going to be March 27th, 2017. So I'm still a couple of months away from the 1 year mark. I'm almost 10 months post-op right now. Let's see. That's really the big thing, was to finally get to be 100 pounds just from surgery. 116 overall. It's been an incredible transformation so far, an incredible process. It's not steady. If I'm going to speak, especially if you're a pre-op or you're just beginning, this is not a steady thing. There is, if you were to look at my weight progression, it's going to be stair steps. You go a little bit and then you stall. You go a little bit and you stall. You go a little bit and you stall. Fortunately, I've not had any go back up. No regain. But it's steps, baby steps, and steps on the scale. So you're gonna have good days and bad days. You're gonna have good weeks and bad weeks, and just roll with it. Just don't give up. Keep doing what you're doing, because especially if you're a duodenal switch patient, it works if you play by the rules. And if you don't play by the rules, your body is going to let you know. Your intestines are going to say, hey, you get this crap on out of me. This is not good, and I don't like it, and I don't like you for giving it to me. You learn, when you have those uncomfortable pains after eating some carbs, you'll be like, ugh, I ain't going to do that again. So you just learn. You learn. Just, I kind of have become a creature of habit, eating the same things. I have on just a small kind of handful of things that I rely on day in and day out, but I don't mind. I'm not bored of it. It gets me to where I need to be. So if it works, if it ain't broke, don't fix it. I drink my fluids. Most of the time, if I drink something, it needs to have protein in it. I'm having just a little drink of water right now, but normally if I drink something, it's either a protein shake that I have made using unsweetened, unflavored almond milk, or I make it in water using one of the Syntrax nectars. Like, my favorite is the pink grapefruit. Pink grapefruit Syntrax nectar tastes like Fresca soda without the bubbles, and I absolutely love it. And then the Syntrax nectar fuzzy navel, it tastes like orange juice with some peach mixed in with it. And those are great, especially in the mornings. It satisfies my craving for orange juice. I used to love orange juice, but now can't have it. Too many carbs, too much sugar. Not gonna do it. But the Syntrax fuzzy navel, it satisfies my craving for orange, and it tastes really good. And plus, it's whey protein isolate, so you get good protein with it. No carbs. It's fantastic. Love it, love it, love it. Anyway, I'm really excited seeing everybody's videos now that you're going on keto. I think it's great. The more research that I've done, you find out that it's the carbs and the sugar that got us to where we were. The carbs, the processed carbs especially, and white flour, white sugar, all that sort of thing, got us to being obese, morbidly obese, super morbidly obese. In my case, super morbidly obese. My BMI was over 50. Not now, but it was then. And it was just the sugars and starches that did it. And when you cut those out and start getting on to protein and good healthy fats and keeping your carbs to a minimum, it really, really does make a difference. After you get over the low carb flu, of course, and get over that carb addiction that you had, the initial carb addiction, and get over those withdrawals, then you feel a lot better. Your energy lasts longer. When you eat something, you don't have that 1 hour crash later on. It doesn't happen. Stuff that you eat, it stays with you. So if you're not doing keto, let me encourage it, because I'm also seeing some patients that what they're eating and what they're talking about having eaten is kind of scary, because they're obviously not following the rules, not even from their doctor's office. I'm seeing patients 3 months out, and this is not de-esters, this is Roux-en-Y and VSGers, because us de-esters are just so rare. True DS patients are so rare, especially here on YouTube. But VSGers and Roux-en-Y people, one person I saw 3 months out now, 3 months out, and this person is eating bananas, is eating oatmeal, is eating yogurt with lots of carbs in it. And I'm not talking about like Splenda, I'm talking about fruit on the bottom type yogurt with sugar in it. Peanut butter, like sweetened with sugar, not natural peanut butter, but the old school sweetened peanut butter with sugar, and making peanut butter sugar cookies. And I'm like, what are you doing? You're 3 months out. Why are you eating that stuff? You're going to defeat the whole purpose And it's those times when I wish that I could just reach through and just give them a hug and say, why are you doing that? Don't do it. You're setting yourself up for failure because you start with the little carbs now and it's just going to snowball, and soon you're not going to be able to put them down again. And you're going to defeat your tool. You're going to out-eat it. And then you've done all that hard work and paid all that money and gone through all that struggle with the insurance and the pre-op diet and all that you've done. You're just going to flush it down the tube for a minute's worth of pleasure. Anyway, reminder, tomorrow is going to be my Q&A video, so be sure to get your questions in. You can leave questions down here below, and I'll try and get to these questions to put in my Q&A video tomorrow. Or you can go to my original video from last week where I was announcing that I was doing an Ask Melanie thing, and go from there. Yeah, I'm still waiting for some good questions. Nobody has asked me where I get some of my crowns from. Guess y'all don't care about the crowns. And nobody's asking me about different types of things. So get in there. Be an investigative reporter. Do some research. Do it on me. Love all y'all. Have a great day. Sparkle on.